I'm excited about sharing my story, and I really want to help other women listen to themselves and then feel comfortable with sharing their questions and concerns. So as I think about when did everything start, I go back to going to my primary care physician. I was thinking that I was just getting closer to menopause, so my periods were starting to go off a little bit, so we kind of decided let's go in and do some blood work. It kind of was the cascade of events that eventually got me to an ER visit. Because of that, I continued to look for other resources, and when I shared this with my primary care physician, she recommended that I see Dr. Kissain.
When I first met Fatma, she was a very warm person, and I was immediately drawn to wanting to help her and figure out, what was going on with her. We ordered some additional tests and kind of started with the most conservative measures to make sure we didn't miss anything, and then just kind of went down this journey of additional testing to find out if there was anything functional going on with her pelvic floor.
It was great to get both teams, as well as our pelvic therapy team, to all talk about it and see what are the next steps. That's when we started talking about the surgery.
We decided to operate robotically because there were some upper colorectal abnormalities as well as very distal pelvic floor vaginal wall abnormalities. We were able to do a combined surgical approach involving myself, the urogynecologist, and a colorectal surgeon, Dr. Devesh.
I was only in the hospital for just one night. I'm just back to the recovery period, and I feel a lot better.
So if a woman is experiencing difficulty evacuating bowel movements, pelvic pressure, feeling of a vaginal bulge, or a general discomfort in the vaginal and pelvic floor area, that's a time when it's probably important to talk to your OBGYN, talk to your primary care doctor about the possibility of seeing a urogynecologist. It's more common than most people could imagine, and many, many women deal with pelvic organ prolapse, urinary incontinence, and bowel difficulties. And so being, bold and seeking answers and not being embarrassed to talk about them with your provider is probably the most important take-home message that I can see here.
One of the things that I learned during this process is you should put yourself first. Even if you're taking care of your family, you're taking care of your patients, for our profession, or taking care of your friends, you should come first. You have to make sure that you have good energy and good health to be able to help others or be a good resource for others too. Right now, I feel a lot better, a better human, a better person because of this, not despite this. So I really, it's almost like it was a life-changing experience in many ways.
We are going to be joined by some esteemed experts from Advent Health for Women, and we're going to talk about how to get what you want and how to get what you need when you see your practitioner. Would you all mind just introducing yourselves, tell us who you are and what you do?
I have laryngitis, I'm sorry, but I'm Patty Joe, and I'm the Chief Nursing Officer for Advent Health Celebration, and I've been, and I'm part of the post-party group that's over 45, so yay us.
And hi, good afternoon, everyone. I'm Dr. Fareed. I'm a maternal fetal medicine physician, and I have the good fortune of serving as the Executive Medical Director for Women's Services for Advent Health for Women.
And I'm Dr. Erica Stockwell. I'm a GYN surgeon at Celebration and also here in Lake Nona. And I just have to say really quick, I go to a lot of medical conferences, and I feel like the information from this conference has the most actionable information of any conference that I've been to, in the past several years.
So agreed, yes.
Mine exploded.
Thank you so much. And I'm Ella of the On Air with Ella show. And I have a question for Dr. Fareed first, please. Some of the topics that we've talked about today historically can be categorized as somewhat awkward in discussing with your practitioner. Anyone? But not anymore, right? We're working on that. But what is your advice to people who might feel anxious speaking to their practitioner about something that feels, deeply personal?
So thank you for bringing that up. So I have two things I have to say about this. Number one, We are grown women. Let us stop talking about your hoo-ha and your vajayjay. All more about your tatas and your wawas and your kitties and your coochies. We are not 14-year-old boys. Oh, boobies, hee hee. Like, we don't stop. Put some respect on that female body and use the correct terminology. Let's begin to normalize, desexualize, and destigmatize conversations around women's bodies. So that would be the first thing I would say. If there's anything, you make a pact with yourself, don't show up to your OBGYN and say, you know, my coochie hurts. It may, but let's get comfortable using that terminology, because if we don't use it, the men sure aren't. The second thing I would say about that is stop apologizing. We are held to such standards of perfection as women. Do you really think when your husband goes for his prostate exam that he is apologizing for his sweaty ass and his sack? He's sure not. He is not. Do not apologize. Oh, you know, I forgot to shave. I didn't get a chance to shower. I should have wiped up. Gosh, I'm so sorry, I had a really heavy period. We are physicians. We have seen it all. We have smelled it all. Do not stop apologizing. You're human. We get stinky. It's okay. So I think that's what I would say is own your body, put some respect on it, destigmatize, use normal terminology, and stop apologizing.
Amen. Thank you. Patty Jo, as she said, is a nurse and a nursing leader, and I just think we should clap for nurses, just real quick. Patty Jo, what do you see women not doing specifically when it comes to their interactions with their practitioner?
They're not being honest. So we go to the doctor and you fill out your form and it says, do you have urinary incontinence? Well, yeah, maybe once in a while when I cough, or, you know, but I'm not going to put that down. Or do you feel anxious? Oh yeah, I do some, but I'm not going to put that down because they're going to think there's something wrong with me. Yeah. We don't tell them the truth. And if you don't tell your physician the truth, how are they going to help you? And when you do tell your physician the truth, and if they say, don't worry about it, it's fine, that's what happens, find yourself another physician. Yeah. All right? So my mom had 6 kids, and she went to the doctor and said, my hands are growing and my feet are growing. And the doctor said, well, you have 6 kids, what do you expect? And I'm like, Mom, that's not right. And she's like, something's not right with me. And she went on for the longest time, and I really pushed her, and I think I pushed her too much, so she stopped telling me. But finally, I was like, I sent her an article. It's like, Mom, you have a pituitary tumor. And that's what she had. She had acromegaly, she had a pituitary tumor. And the doctor for years told her, when you have 6 kids, your feet and your hands should grow. That does not happen. So we have to speak the truth, and we have to know that if it doesn't feel right in your heart, you know it's not right, find yourself a doctor or a very good nurse who can tell you which doctor to go to, because that's the best way to find a doctor.
Is it fair to say that we need to be our own best advocate first?
Very much so.
Thanks so much. Dr. Stockwell, people say all the time, know your numbers, know your numbers. You say, know your symptoms. Yes. What do you mean?
So I think knowing your numbers is definitely part of the picture, but I think even more important than that is knowing your symptoms. We as women, we're all different. We all present differently with menopause and the degree of symptoms, but also just the variety of symptoms, as you guys have heard throughout the entire day today. And I think with the focus of treatment, I think we, for some of my patients, I'd say we get so caught up on the number and trying to get to a certain number. And I think more important than that is really, how are you feeling? Is it helping with your symptoms? If not, maybe we need to increase the dose of your HRT. If you're good, well then, if you're feeling well and we're getting that quality of life metric back, then really, does a number really matter at that point? Is there a number that's too high, a number that's too low? I think really focusing on the symptoms and knowing your symptoms and knowing the improvement in symptoms over time. I talk to my patients about looking at quality of life metrics. And for some of my patients, they say, well, I just want the energy to keep up with my teenage kids. Or I want to be able to have sex and not have pain. Or I want to be able to get through the day and not have to rip my clothes off because I am so hot and I'm so sweaty. So I think if we focus more on the symptoms and the improvement in symptoms and the quality of life metrics, because not all women are the same. We're not robots. So, one level of estrogen for one woman, they might feel very differently than whatever level of estrogen for another woman. So I think it's kind of reframing and focusing on those as the end goals.
What do you see, this is for anyone or all of you, what do you see women write off as normal that's not?
Yeah. Well, I think a lot of the things that we talked about today, so for sure the pain with intercourse, I get so many patients that say, well, I know this is just because I'm postmenopausal, or, I know this is normal. Urinary incontinence, that's a huge one that we haven't talked as much about today, but I have so many patients that say, well, I know this just happens because I had 4 kids, 6 kids, and I'm postmenopausal now. These things, while they may be common, don't have to be your norm. There are treatments for these. There are things that we could do to help. There's plenty of things out there, including hormone, including non-hormonal, and including a combination of these different things that we can put together to help women.
To dovetail off that, painful periods. A period should not knock you on your butt for a week. It should not be so debilitating that you have to miss work. So just like as Dr. Stockwell said, bring that up because that is not normal.
Yes.
Yeah, I agree. I think that a lot that we spoke about today is what, when I talk to my nurses, they'll complain about, but they think it's part of growing up or growing older, that they have to deal with this. I think that if it's not your normal, you should take care of it. I mean, we should not wake up feeling achy every morning. We should not wake up feeling like we're foggy, that we can't get through the day. I mean, these are things, when I started my hormonal therapy, my life changed because I'm 66. So years ago, it was the whole research of you shouldn't take estrogen. It's not good for you. So I went years without it. When my OBGYN convinced me to start it, it was like an awakening. So if you're not on it and you think you need it, really go have somebody check your levels.
Yeah, I think that so many of us had the experience where the generation or two before us, they were told quite literally just to get through it.
Correct.
This is it, just get through it. And I think that one of the most empowering things that's happened today is that we've learned that that's a load of caca, and things don't happen just because you're aging is not an excuse to feel terrible. Menopause is not an excuse to feel terrible. So I hope and I trust that everyone in here feels empowered by the experts that they've heard from today to know that you absolutely do not have to settle.
No.
There? Tell me, each of you, Patty Jo, you kick us off. What is one piece of advice you would like to leave everyone here with?
Women tend to be people pleasers.
What?
It took me a really long time to get over that, but if you do not set time for yourself, you will not do it. So it took me a really long time in my job. Everybody was more important. There was a meeting that was more important. There was somebody needed to meet me was more important. So I finally, about 6 years ago, said 3 times a week at 4 o'clock is my non-negotiable. You want me to stay in this job? At 4 o'clock, I'm working out. You can put a meeting on my calendar, but I will not be there. Everyone knows that. My CEO knows that. My CFO knows that. They all know that that is my non-negotiable. I will stay till 7 o'clock and 8 o'clock at night and work, but at 4 o'clock to 5 o'clock is my workout time, and I will not miss it. And if there is a meeting, I have a great trainer, and he will adjust the schedule, but I am definite, I have to do that 3 times a week.
I think calendaring time for yourself and the things that you want to do is so important. It's such an easy thing to do, but it's a great, just quick tip. Put yourself on your calendar. Thank you.
Yeah, we put our kids, all their activities on the calendar, right?
Yeah.
Right?
Thank you so much, Dr. Puri.
Yeah. Now, I think to dovetail off of what you said is put yourself first and make sure that you prioritize yourself, and don't be afraid to step into your power, step into This is okay. Don't feel bad about saying no. My God, why do we feel so weird to say no? It's okay to say no. The world will not fall apart. It will go on just fine. Make sure to put yourself first, advocate for yourself. And that's what I would say exactly. Set those boundaries and then make sure that you are taking that time to care for yourself as well. It's okay to do that. You have permission to do it. You should do it.
But taking care of yourself isn't selfish.
Correct.
No. In fact, it's a revolutionary act these days. So you're a rebel. And also, you know what I love to tell women who feel that they are somewhat accommodating or people pleasers? If you aren't willing to do it for you, then do it for the people who love you. Put yourself first to model how a woman can live her life, and put yourself first to stay healthy for the people that love you. Thank you so much, Dr. Stockwell.
I guess I would just, again, dovetail off of the same thing. I think for women to be advocates for yourself and really, speaking from a physician standpoint, I can tell you that there's still a dearth in the education with regards to menopause. And because of that, it's almost shameful to say that there's so many of my colleagues who actually don't even prescribe hormone. They just don't treat menopause, which is crazy. It's 1/3 of our population that we see. And so be an advocate for yourself. If you're not getting the care that you need from your provider, go ahead and seek another provider who will give you the care that you need. Me, as a provider, I learned so much from my patients as well, and I take those things that I learned from my patients so that I'm able to actually offer it to other patients as well. A lot of these things that over-the-counter, vaginal lubricants and sex help and stuff and podcasts and things. I have a whole long list, and I got them all from my patients. So definitely bring that to your providers. Let them know what works for you and what helps, so that they can share that knowledge and help their other patients. And be a voice. Go out there, tell everybody about this conference, tell everybody about this information, so that more and more we bring the education that needs to happen.
Thank you so much. And we are so excited for where Advent Health for Women is going. Thank you for being a part of this. Thank you for sponsoring today.
Thank you.
And a warm thank you. Thank you. Thank you. Thank you. We're done.
Thank you.